Hey, what's up? It's Dr. Ryan, and we're going to run through some shoulder pain today. Shoulders are one of the most difficult because they're very intricate and there's a lot of motion in that joint. Shoulder pain can come from a lot of different areas. And so when someone comes into the office and they talk about their shoulder hurting, truly what we need to do is figure out where. So you really have a lot of different potential problems. You have your GH joint, which is your glenohumeral joint, which is the ball and socket. You have your AC joint, which is where your clavicle here meets the acromia, which is a bone that attaches to the scapula in the back here. So if we're just talking about here in this joint in the shoulder, if we get up in here, then you're talking trap, you're going around the shoulder, but that's a different area in my opinion. So we're just talking about right out here, okay? So you have the GH, the AC, and then you have what everybody loves is the rotator cuff. Rotator cuff is a series of 4 different muscles. You have, it's called your sits muscles, your supraspinatus, your infraspinatus, your teres major and minor, and your subscapularis, okay? And so there are a lot of muscles going on with that. And so when there are a lot of muscles that do a lot of work in a joint that has a lot of range of motion, you can understand that there can be a lot of potential problems here. And so what we have to do, and we're gonna talk about the main ones through this video series, but just understand, if you have anterior shoulder pain, you're usually looking at rotator cuff, GH joint, or possibly AC joint, but AC is going to be a little higher. So your AC, your acromioclavicular joint, it's going to be a little higher. That pain's going to be a little bit more up here. Here's going to be more bicep tendon supraspinatus usually. When you get to the back, you're going to deal with rotator cuff, infraspinatus, teres major and minor, supraspinatus potentially. Usually supraspinatus is going to hurt here or on the lateral side. But when you get back here too, then you could be talking about labral injuries. They're going to be more common in the posterior, at least from what I've found. You're going to get a lot of potential labral issues here. And your GH joint, that's that deep boring pain. That's where it's real thick. It just goes all the way through. It can be in the front, can be on the side, can just be the whole thing. So those are some of the areas that are the big pain indicators. So you get your posterior, your anterior, and then just deep through that, or the superior up through here. So find the pain, then you can start figuring out what that pain generator is, and then you can figure out what to do about it.